Thank you for giving me the opportunity to speak. As I mentioned, my name is Jumaane Williams, Public Advocate of the City of New York, and welcome to today's Mobile Response Conference. It is a great pleasure to be here to speak to everyone. It's important to provide services such as these for New Yorkers so that they can get the help, particularly when they're distressed. And so it's exciting to see so many people gathered to speak about it. I also know that there are some members of the Adams administration here, and I do want to thank those who work in the administration, many of whom I know, who are really trying to do the best they can in some difficult situations. I know there are some people who are trying to lead in the way that I think many of us want, but I have to say I wish they had a better leader to try to help them get that done, and that is a problem for me, and I'm going to continue to call that out. But that does not mean that there are great people in the administration doing the best they can in a difficult situation. Mental health has been a key focus for me, both in my life and in my office. My office's first report was on mental health crisis response because people in mental health crisis deserve a healthcare response, as many of you know, not a criminal one. Unfortunately, we have a 24-hour system that is trained to provide criminal responses. We do not yet have one that is trained to provide healthcare responses, or mostly not anything other than criminal. Unfortunately, 3 years later, when we released our second report, the city had gone backwards in many ways. Government moves really slowly sometimes, I know, but this was especially frustrating because this is one of those areas where across a pretty wide ideological spectrum, as was mentioned, most people seem to agree and know that mental health crisis demands a mental health response. I've seen this swing in the past 15 years in a way that I couldn't imagine 15 years ago, that everyone now understands that people in mental health crisis do not need a criminal response, and was mentioned, by the way, most law enforcement do not want to be the people responsible to respond to most of these things. Yet, despite broad agreement, it's not moving forward in the way it needs to. I think it's because this isn't something you can just dip your toes into. If you only try to do something halfway or less than halfway, you can't be surprised when it doesn't work exactly as intended. And you can't abandon it, but you have to push further. Here in the city, that's best exemplified by a program called Be Heard. A few years ago, partly in response to our advocacy, the city piloted Behavioral Emergency Assistance Response Division, or Be Heard, an alternative response program that would pair mental health workers with paramedics, EMTs, as a response team. But this program is only being deployed for a small fraction of 911 mental health calls. Only about a third of all mental health calls made it to the city. Out of the eligible mental health calls, Be Heard, the teams responded to 14,900 calls, accounting for 73% of all eligible calls in the pilot area during the program's operation. Even though that number is increased and we're happy about it, it's a bit of a misguided statistic because a huge portion of the calls that come in are outside of hours or outside of staffing feasibilities and outside of those pilot programs. It's nowhere near the scale we need to meet the mental health crisis in our city and other municipalities nationwide. It's in gatherings like these spaces where we can collaborate across cities and systems that we can figure out ways that we can further support this critical and life-saving work. We must not simply rely on law enforcement in mental health emergencies, but also focus on health professionals and crucially peers, people that those in crisis can trust because they understand the experience. We also know that sometimes the presence of someone in uniform, someone with a gun and a badge, can elevate the situation even amongst the best trained law enforcement. I spent time with our mobile outreach teams, with our respite centers and clubhouses, and I know both how difficult and how essential this work is. In any given year, more than 1 in 5 New Yorkers experience psychiatric illness, with low-income people of more color often unable to access any treatment or support at all. And as was mentioned, any time that we have an issue we cannot solve, we send police to try to fix it. That's unfair actually to the police and to the people in the community. Barriers to effective care include a host of issues related to a lack of adequate insurance, stigma, discrimination, lack of access to stable housing, plus others. Alternative mobile services could also include street outreach that supports the homeless, or assist agencies which provide in-person mobile response teams to individuals in crisis. Too often, those in crisis in our streets are hidden away more than they're helping, because helping is harder than hiding. But we need to meet people where they are with the resources that they need. Very often, I hear people saying they want to solve the homelessness crisis when they mean they don't want to see the homelessness crisis. Whether these services consist of nurses, technicians, or a combination of skilled workers, such responses and treatment can essentially be life or death for someone experiencing a mental health crisis. Such care, response, and outreach can help to keep residents experiencing mental health crisis within our communities safe. As we all know, people who have mental illness or mental health issues are more likely to be a victim of crime than commit crime. I want to also talk about involuntary transports, one of the mayor's favorite things to talk about. In November 2022, the mayor released a mental health involuntary transport protocol outlining the process by which involuntary transports initiated by clinicians and/or police officers would be conducted. The 2024 report that from the Mayor's Office of Community Mental Health Mental Health cites 58% of clinician-initiated transports resulted in admission of a New York City public hospital, but the report fails to report on outcomes for officer-initiated transports. What I think will be shocking to most New Yorkers is that almost 8,000, a little over 8,000 New Yorkers have been in voluntary hospitalized last year alone. The way it's discussed is as if this tool is not used at all. The gap is providing critical policy making because the state has recently expanded involuntary without knowing whether it works, whether people are being treated with the full continuum of care that's essential. There were about 661 that were initiated by clinicians. We have some of the data, as I mentioned. Over 7,000 were initiated by law enforcement. As of right now, we have none of that data. And we already have laws in place that we aren't even using. As I've discussed before, as I've tried to explain to the mayor, there's a decade-old state law already in place which allows for mental health incident review panels to be convened to review gaps in service. These panels are intended to review circumstances, address missteps, and prevent harm. This isn't solely about individual incidents. It's about understanding how one gets to the point of crisis. To suggest that it is not helpful to trace the cause of mental health incidents is like arguing against autopsies because they can't prevent the death that took place. We have to examine the spaces where people get left behind in order to make the changes that will actually help people get the services they need and protect public health and safety. By the way, does anyone want to know in the past decade how many mental health review panels have been done? Donut. Nothing. Zero. And as I mentioned, there's already a massive disparity in the data that we have and who's deciding who gets involuntary hospitalized or not. Of course, that's a massive problem. But even then, for the clinician-initiated incidents, we at least have transparency about where these people went and what happened next to some of them. As I mentioned, people who are ordered by police to magically get better are far less likely to continue any treatments or see lasting benefits. Sometimes people do need help in a way they can't realize or obtain, and we have an obligation to help. But involuntary transport shouldn't be the tool, shouldn't be the plan. It is a tool. We can't use it immediately. It can't be indiscriminate. The choice is not between doing nothing and doing the wrong thing. We need the capacity to make services more accessible and to be able to repeatedly offer, not require them to people most in need. It's not surprising that polls suggest New Yorkers supported expanding the commitment of individuals in need, but I suspect this relates to the idea that someone should do something, and we believe someone should. And if people think someone should do something and you offer them a thing, they're going to think that that's what they need to do. We should and we can, and I hope we can work together in this conference and beyond to actually get this accomplished. As I mentioned, involuntary hospitalization is a tool. That tool already exists. The problem is not being able to involuntarily hospitalize folks. The biggest problem is folks don't have a continuum of care after they've been hospitalized. And so you can hospitalize someone for 3 days or 3 months. If you let them out without a continuum of care, you will have a problem. And what we need our leaders to do is not feed the fear that people have, because they actually have it, but actually try to find a way to address the concerns that are causing the fear in the first place. Mental health is not new. Recidivism is not new. We've been dealing with these problems for a very long time. Our leaders promise to assist and help, and they never do. They often try to lead off of headlines as opposed to leading with the data. Lastly, since George Floyd was mentioned, I do want to say we often have people that use things to avoid the real conversation. And during the George Floyd protest, we heard a lot about defund the police. As much as I'm associated with it, by the way, I've never said I thought it was a bad slogan. It's a bad slogan then, it's a bad slogan now. However, I told folks, why are you spending so much time arguing with people in pain in the street on a slogan when you could be trying to figure out how to address the pain that they have in the first place? And the issue I had with that is, I think everyone can dream of a society that does not need armed people to keep everyone safe. We are also not yet in that society. But my problem is when you tell people they can't even dream a dream, how will you achieve it? And so we must be able to at least name the thing, or else we won't be able to get to it. And if you're not allowed to name the thing, then we have a problem. Our law enforcement, I believe, are partners. As mentioned, they have a very specific role to do, and they don't want to be called to doing everything. So the best way that we can support law enforcement to do the jobs that they can do is to make sure that we fully invest money and infrastructure for the other things that they are not equipped to do. We have to make sure we have the infrastructure so that when my sister calls, like she did, asking for assistance for someone who clearly was in crisis, and she was afraid, but didn't want to call the police because she was afraid about what happened, who should she call? And I did not have an answer for her. That is a problem. So I thank everyone who was here doing the best we can to find some kind of alternative to what everybody knows is a problem. By the way, we have some of the answers. We have to expand it. We need leaders who are going to fully invest in it and build out the infrastructure. There will be mistakes. There will be harm that is caused. There's mistakes made now. There is harm that is caused now. Why is that? The only thing that we move forward with, law enforcement, even when people die, even when mistakes are made. So if we can move forward with one, we can move forward with the other, particularly when we know the other is the best way to move forward to keep everyone safe. Thank you so much for the opportunity. I appreciate you all. Peace and blessings. Love and light to everyone.